name is Evanie. I'm a student nurse from the College of Central Florida, and I'm here to do trach suctioning. I've already checked my physician's orders, and I've already explained the procedure to the patient, which she's been suctioned prior, so she knows what to expect. So I'm going to go ahead and knock on my patient's door. Knock, knock. I'm going to go ahead and go in, and I'm going to go ahead and wash my hands as I go in, and I'm going to provide for privacy. And for the purpose of the video, I'm going to leave this open so she can record. I'm going to go ahead and check my suction and make sure it's turning on and on intermediate between 80 and 120. And make sure my tubing is over on the side of the bed, which it is. And then I'm going to go ahead and put my supplies down on the table. And I'm going to wash my hands again before I touch the patient. I'm going to check her name badge against my physician's orders. And it says Mrs. Jones, 7588. And it matches my physician's order. Once I've done that, I'm going to just make sure I got my bamboo bag. And I'm going to go ahead and lift the head of the bed up. We'll lift the bed up to my working height. I'm going to let the rail down. And I'm going to move this pillow here so she's able to hyperextend her neck if I need her to. Mrs. Jones, I want to go ahead and set up a distress signal. If you have any problems during the procedure and you need me to stop for a minute, just put this hand right here up, okay? She shook her head yes, so she understands. I'm going to go ahead and do my lung assessment. I'm going to listen anterior and posterior. I hear wheezes, and I'm going to go ahead and check her respiration rate, her color, her capillary refill, and get everything situated. And I've already explained the procedure to her. She knows what to expect. She's had it done prior before. And again, I'll check my physician's orders. I'm going to go ahead and wash my hands now before I start setting up my supplies. And I also have already completed my respiratory assessment. I will also have on PPE at this time, which consists of my gown, my gloves, and a face mask with a shield. I'm not going to wear it for the purposes of this video, but in real life, that's what I would have on. Okay, I've already washed my hands again before I start touching my supplies. And here I have my normal saline. I checked the expiration date. It's January 1st, 2017, so it's still good. It's not open. I don't have to worry about when it needs to be discarded. I'm going to go ahead and put this chuck on the patient to protect her clothing. Okay. My tubing is here. Okay. Now I'm going to go ahead and open my supplies. Okay, this is sterile. I'm going to make sure I do not touch the inside because it is sterile. I'm going to go ahead and open my normal saline. I will palm it and lip it. And then I will go ahead and pour some in my little sterile container here. I'm just going to move this closer to my suction. Okay. Then I'm going to go ahead and open the rest of my supplies. I have a 1-inch border here. I'm going to go ahead and don my sterile gloves. And I will go ahead and get another pair of gloves because I just ripped these. And then I have on my gloves now. I'm going to go ahead and oxygenate my patient with my non-dominant hand. Take the oxygen off here. And I'm going to give six breaths here. Oops. 1, 2, 3, 4, 5, and 6. Go ahead and put the oxygen back on. And then I'm going to go ahead and get the suctioning and get my I'm going to go ahead and connect my two sequins here. Okay. Okay. Wrap this around my hand. Okay, now I have my tubing connected. I'm going to go ahead and test my suctioning real quick. And it is suctioning, it's working correctly. Okay, and then I will go ahead and remove the oxygen off my patient. Okay, Mrs. Jones, I'm gonna go ahead and suction you, okay? All right, and then I'm just gonna go in. So I meet resistance or the patient is coughing. And I met resistance, so I'm gonna pull out 1 centimeter. And I'm just going to apply intermediate suction as I twist and as I pull out. And the suctioning is only going to be about 10 to 15 seconds. Okay? And then I'm going to go ahead and clear the line. Okay? And I'm going to wait 1 minute in between my first and second pass. I'm going to apply the oxygen back. I'm going to wait 1 minute. And then before my second pass, I will go ahead and hyperventilate the patient again. Oops. 2, 3, 4, and 5, and 6. Okay. I'm ready for my second pass. Okay, Mrs. Jones, we're gonna go in again. Again, I'm going to go in so I meet resistance, or the patient is coughing. I'm going to pull out 1 centimeter, and then I'm going to apply intermediate suction as I twist. Okay, and then I'm going to go ahead and clear the line again. Apply the patient's oxygen. And I'm going to go ahead and, at this time, I will go ahead and complete another respiratory assessment. Listen to the patient anterior and posterior. And get O2 stats, listen to get respiration rates, to make sure I don't need to do a third pass. And since I no longer hear wheezing and her respirations are at a good rate, I would go ahead and discard this because I know I do not need to do a third pass. I'm gonna go ahead and clean up here. And I will go ahead and throw all this away. The normal saline is good for 24 hours, so I'll probably leave that in here. But I will date and time it, what time I open it. I will go ahead and put the rail back up, let the bed down. pillow back behind your head, Mrs. Jones. I'm gonna go ahead and sanitize my hands. Ms. Jones, here's your call light, okay? If you need anything, let me know. I'm gonna make sure I turn off my suction. And then I would sanitize again because I just touched stuff in the room. And I will open up my curtains and I'll be sure to document my findings.